chance of a shower. But again, the Coastal Carolina Fair starts on Thursday for 11 days now, not 10 days, but 11 days. Now here's John Bruce.
You know, we've heard a lot about heart disease in recent years and how to take care of yourself to stay healthy. But what if you already have heart disease? For the many Americans who do, a new survey offers insight into the best treatment options available. And here to explain more is Dr. Jeffrey Marshall, president of SCAI, and Gary Lawrence, a heart disease patient. Gentlemen, thank you so much for coming on the program. We do appreciate it. First off, let's get started. Dr. Marshall, tell us about this survey.
So this is a survey of about 500 patients who had either angioplasty and a stent placed or open heart surgery for the treatment of their heart disease. And we looked to see how that affected their quality of life. About 4 in 5 patients that had angioplasty and stenting had marked improvement of their quality of life. They were able to get back to work about 3 times faster than people that had open heart surgery, and they were less likely to feel like they were a burden on their family. Maybe most importantly, about 12% had an increase in their sex life.
And Dr. Marshall, can you tell us what the significance of those results are?
Well, I think the significance of this is that people are getting back to work faster. You know, in South Carolina, almost 7% of people have diagnosed heart disease. And if you have heart disease that's so severe, you need to have an angioplasty and a stent placed. It's important to get back to work and get back to your normal lifestyle.
And Gary, you suffered from heart disease. Tell us all about your experience, please.
Well, my experience was at about 18 months, I've been noticing shortness of breath and fatigue. After exercise, I was taking a longer time to cool down, and moving some heavy boxes around as we were moving really pointed out the fact that I needed to talk with my cardiologist, share my symptoms, and really see what the next steps would be if I needed additional treatment. And what came about was angioplasty with 2 stents to take care of 2 blockages I had that were causing these symptoms.
Now, you've had the procedure. Tell us how your life has changed since the operation.
Gee, in the last 2.5 years, first of all, I felt great after the procedure. Coming home from the hospital, back to work in just a couple of days. Then we celebrated our 40th anniversary in Europe. Got to do a lot of touring, and now I'm retired, taking part in water sports, exercise, and really using a lot of my additional energy to get involved in community affairs and be very active in the community.
Well, no pun intended, but does it feel like the gorilla is off your chest, so to speak? I mean, how much better do you feel?
Well, you know, it wasn't exactly a gorilla. But it was still pretty heavy. And you know, the fact that I had a hereditary disease, if you will, passed along from my grandfather and father, managing it well prior to the angioplasty, but at the same time knowing that at some point, you know, I might be coming up on this was really something I kept myself aware of and tried to follow my doctor's orders as much as possible.
So, Gary, if there's a message out there for someone who might be having similar symptoms that you did before the angioplasty, what would you say to them?
I would really say to them, you know, there's some lifestyle changes you can make that will help you prior to reaching the point where I did, especially non-smoking, watching your diet, and you know, plenty of exercise if at all possible.
All good tips. And Dr. Marshall, quickly, where can we learn more about this great survey?
Well, a great website would be secondscount.org.
All right, fantastic. Gentlemen, thank you so much for spending some of your time with us. We really do appreciate it.
Thank you.
Thank you.
And we'll be right back with more Low Country Live in just a moment.